Yes, correct. What you have said is rightly put forth. Actually, people neglect their symptoms a lot. And the point what Dr. Rakesh has come up with is that Indians and South Asians have a lot of heart disease. And one statistics I want to put forward to you is that 60% of all the world's heart disease cases are in Indians, whereas we have only 14% of the world population. So you can imagine the immense load that is there on the health system because of this. Now coming to the symptoms, normally 75% of all heart attacks, they will come with symptoms. 25%, this is also another statistics we should be careful of. 25% of all heart attacks are silent, means there will be no symptoms at all. And this especially occurs in diabetes in mellitus and some other nerve disorders, but mainly we should be careful that these four symptoms, namely palpitation, that is you are aware of your heartbeat, that is palpitation, then breathlessness, means suddenly you are out of breath, then chest pain. Chest pain is another, means wherever, it may not be on the left side, it may be right side, it may be in the arms, it may be in the jaws, anywhere, right, starting from the upper side of the abdomen, right up to all the chest and even towards the back, it may be a sign of heart disease. And fourth symptom is if you are feeling tired or if you are feeling giddy. So that means if you are easily getting tired, or if you are getting some sort of giddiness and you are about to fall or you actually have a fall, so these are the symptoms that you should be careful of. Also another thing is that if you have some sort of wheezing or cough, please consult a doctor and make sure that it is not a sign of heart disease, and you always think that maybe this is a sign of asthma. There is a very famous saying in our cardiology circles is that all that wheezes is not asthma. So you should be careful of this. Another symptom that we normally attribute to heart disease is that people come with gastric or hyperacidity symptoms. So this should not be neglected at all, because at times we have seen that people who have come with gastric kind of or hyperacidity symptoms actually have heart disease or may be having even a heart attack. So these are some symptoms you should be careful of. This is a very interesting point that you have brought up. Now, a long time ago, there was a cardiologist called Samuel Levine, who came up with this sign, and he said that this is, if anybody is coming with a clenched fist or complaining of some sort of pressure symptom over the chest, then that is most probably due to heart disease. If he is coming with, and pointing and saying that this is my chest pain, then it may not be heart disease. Secondly, the cough that you talked about. Now there are various types of cough, especially if you are getting cough after lying down, or if you are getting breathless after lying down for some time, and especially if you are waking up in the middle of the night with some sort of cough, then that means it is a sign of heart disease. We call that PND. Or orthopnea, paroxysmal nocturnal dyspnea, means as soon as you start lying down, the lungs are sort of filling up with water. So the lungs are getting irritated, and that irritation causes cough. So that may not be a very, very productive cough, but at times it can be when the lungs are full of water, and we call that situation as left ventricular failure with pulmonary edema. So that can be. And sometimes the symptoms and the cough and the production of cough, especially with sputum, may be overlapping with symptoms of tuberculosis, which is another very common this thing. And we have sometimes, even blood in the sputum, which may be due to heart disease. That happens in extreme cases of acute left ventricular failure with pulmonary edema. One patient who actually just after his morning walk, he was having coffee. He's from South Goa. I can't take his name obviously, but he was having coffee and then suddenly he collapsed. Now his son He's a seaman. His son is a seaman, and he has been trained in CPR.
Okay.
So he saw that suddenly his father has collapsed. So he felt the pulse, and he felt that there was no breathing, and he immediately started pumping.
Okay.
And he was revived. And he's still alive today. So he was brought to the hospital, and then because it was a case of cardiac arrest, we put in a ICD.
Okay.
That is an implantable cardioverter defibrillator, and everything was fine because he had a rhythm problem. Means it is like a short circuit in the heart. Like heart has two aspects. One is the wiring and one is the plumbing. Now what we are generally talking about here is the plumbing. But the wiring also sometimes can go abnormal, and this is what happened in this case. But I am really thankful that his son had learned CPR and he managed to do it at the right time and saved his own father. Yes, very interesting question. Now the thing is that ECG, like Dr. Jyoti said, that it is absolutely essential, and it is almost 100 or 99% diagnostic of a heart attack.
Okay.
Now in the situation that it is not a heart attack, then the accuracy goes down to around 30 to 40%. No, hone wala hai, we can never know, because we have seen so many cases of absolutely normal investigations with 99% blockage.
Okay.
So hone wala hai, we can never know. But yes, ho chuka hai, we come to know. And
that's
another thing
that's an interesting, because I also do not know what exactly ECG is.
Yes. ECG is basically an electrical pattern due to whatever mechanical abnormalities that have occurred in the heart.
Okay.
ECG is that.
Yeah.
In case it is abnormal, but if it is normal, that also shows the normal electrical pattern of the heart. So that is what I was saying. Heart has a wiring. So ECG is looking at the wiring pattern and the electrical pattern to detect something which may be mechanically abnormal in the heart. So that is what an ECG is. After this, there is another thing that what we do is we look at the echocardiography. Echocardiography is like a ultrasound of the heart. So basically, it looks at the heart with sound waves, and it tries to detect whether there is the flow. What is the flow pattern? Whether there is any abnormality in the valve, whether all the walls are contracting normally or not, whether the heart shape, size, everything is normal or not. That all we can see on the echo. Third, when we come to this, before anything has occurred, then we do a stress test. That is known as a TMT, treadmill test. So in that also the accuracy is up to 70%. So it may still miss 30%. Like you said, na, hone wala hai. So that hone wala hai situation can be detected by treadmill test. We can go to slightly more accurate tests that are known as dobutamine stress echo, or else we can go to stress thallium. So these are slightly more accurate, maybe around 85-88% accuracy. The thing that is compared as 100% accuracy means the gold standard of knowing whether there is any blockage or not, and against which we compare all this ECG, echo, TMT, everything. That is the angiography. Angiography is nothing but basically a flow. We are checking the flow through the coronary arteries. So there are 3 coronary arteries. What we do is normally 90% of the time through the wrist we take a small pipe which we call a catheter, and we go up to the heart. It is under local anesthesia, so patient doesn't feel any pain. So there is no pain involved. In fact, inside, unless there is a problem, normally the human body doesn't feel any pain. So there has to be a problem only where after that the human body feels pain. So we take it up to the heart. On top of the heart, there are 3 arteries which supply the heart with everything, with oxygen, glucose, everything. So those 3 arteries, turn by turn, we push the catheter, and then we push a dye, which is radio opaque, means it can be seen on X-rays. So those moving X-ray pictures are known as angiogram.
Okay.
So that we see on the screen, and we decide, okay, how much percentage of block is there. It may be anything. If it is less than 50%, generally we don't do anything. More than 50% in the absolutely main vessel, then yes, we have to do something. And more than 70% in any of those three arteries, then yes, we have to do something. If it's in a branch artery or in a distant branch, we sometimes don't do anything, or we just give medical treatment. So this is actually what angiography is. Angioplasty, on the other hand, what we do is we have to remove the blockage. Now, how do we remove the blockage? We first put a wire through that blockage. It goes through the blockage somehow and goes beyond the blockage. Then we put a balloon so that it flattens the blockage. Once we have created enough space, then we put in a stent. Now that stent is nothing. If you remember our ballpoint pen spring, it is exactly like that.
Okay.
Only thing is, it is collapsed and it is mounted on a balloon, so that it can easily pass through the blockage. And once it is at exactly the site of the blockage, we expand it so that whatever we have expanded, the blockage, it doesn't collapse again. Because earlier angioplasty meant only balloon angioplasty. So people used to just go do ballooning and come back. But what happened is, immediately after ballooning, maybe after a few hours or a few weeks or a few days or few months also, it used to collapse again. So to keep that thing open, to keep the walls apart and open, we put in a stent. So that is what a stenting is. Yes, correct. Actually, what you have pointed out is correct, and that we as group of Indians, we have forgotten the value of exercise. Earlier, we were mostly a agriculture-based society, and in that we used to do we never had to do specially some exercise to take care of our body. But now what has happened is we have become more, more into this Western culture and more into a sort of urban culture, and that has taken toll on our bodies, especially physical health and heart health. Now what we need to do to get back to our normal or earlier stage, we always say that there's a common saying in our society is that our fathers and grandfathers never used to fall ill because they were having asli ghee or what, asli coconut oil. But it may not be totally asli ghee and totally asli coconut oil which is responsible. What is actually responsible is that there was more physical activity at that time. I remember when I was a young boy and we had to go somewhere, we never had any scooter or motorcycle. There was only one car, and that was a family car, and whenever there was a family outing, we used to go. Otherwise, there was all the cycle and walking. So that time we took care of our bodies that way, and it was a sort of unknowing kind of activity. Now we have to switch over to a knowing kind of activity, and for this, like they say, now for everything there is a protocol. So the Americans have come up with a protocol for this also, for exercise. So they are saying that 5 days a week you should exercise. It should be 150 minutes per week of moderate intensity exercise, not the high intensity exercise that Puneet Kannada actor was doing. Puneet Rajkumar. He was doing high intensity training. So that is not recommended. In fact, what we now see is that if there is lack of exercise or if there is too much of exercise, it's a J-shaped or a U-shaped curve, and the death rates are equally high in both. Means if you do more exercise or if you do absolutely no exercise. So the amount of exercise also has been quantified. We should do 30 minutes of moderate level exercise, that too no lifting of weights. Please don't do weights. No gymming, no weights, only moderate level of exercise. What is recommended is cycling, swimming and walking. If you are very overweight, don't do too much of walking because you will wear out your joints. If you can switch over to cycling, and best is swimming, which is almost like a weightless kind of environment. Avoid gymming totally. We have seen so many mishaps in Goa. There have been physical trainers in some famous gyms who have collapsed and come with a heart attack.
Yes, yes.
So I don't want to name anybody or the gyms, but I'm just saying, please don't do, if you're going to the gym, just do some normal kind of, without lifting weights, do some treadmill or some rowing or something like that. But cardio is what we normally say. And especially another thing is, if you're going to the gyms, please avoid those supplements. Yeah, those supplements are God knows full of what. And another thing that, because most people out here are non-vegetarians, I'd like to say that yes, you should have proteins if you're exercising, but please avoid the dairy and the poultry chicken, because that is full of antibiotics and full of steroids. And antibiotics will give you antibiotic resistance, and you will not get the benefit of antibiotics when you need it most. And steroids will give you a host of other diseases, infections, as well as steroids cause thrombosis. Along with the latest COVID, which is also giving us thrombosis. So we have to be careful. Another thing what Dr. Rakesh, and you asked Dr. Rakesh about latest things in cardiology, I'd like to point out there are some 2-3 things which have actually dramatically altered the landscape of treatment of cardiology. One is that TAVI, or basically valve replacement without undergoing normal surgery or the bypass or the open heart. Okay, so that is TAVI. So what we do is, through the groin we approach and we change the valve. We don't exactly take out the valve, we put in another valve inside that same space where the valve exists. So that is one thing. Second thing is that what regularly cardiologists like Jyoti and I are doing is that we are doing IVL. IVL is intravascular lithotripsy. Now that same technology that was used for breaking stones in the kidney is now used for breaking the calcium inside the coronary arteries. So very hard to stent lesions, means sometimes it is very tough and very hard, and there are calcium spicules inside. So the balloon also bursts and the stent also cannot be placed properly. So in such situations, what we do is we place that IVL balloon and we break all the calcium and then we create a smooth passage. There is another way to do that, that is called rotablation. And we have also regularly done that. Yesterday only there was one patient of mine, in 2015 he was advised CABG or bypass surgery. In 2017 I did his rotablation. Yesterday he came, he's absolutely okay. So I am also happy. God has given me this chance to treat patients with new technology. Another thing that has again revolutionized, like he said, that there are some devices which can take care in cases of heart failure. We have done that in Manipal. That is called CRTD. CRTD basically has like a pacemaker has 2 leads. CRTD has 3 leads, and it synchronizes, means if the heart movement or the heart pumping is not synchronized, then that will lead to heart failure. So if we can somehow synchronize it, now how do we synchronize? We basically give electrical signals. Nature is also giving electrical signals for pumping of the heart. We are also doing the same through the help of a special pacemaker that is called a CRTD. Another thing that has revolutionized this technology, our field, is that now we have leadless pacemakers. Means pacemakers which can be implanted directly into the heart, and they stay there, and there are no visible marks of any surgery or anything outside. And that pacemaker takes care of the rhythm of the heart, so that the heart is pumping on time, and there's hardly any surgery or anything involved in it. So these are some of the things that have revolutionized our field.